why is it a very important topic? So heart disease is the #1 cause of death in the United States. 2020 and 2021, #1 of cause of death was COVID disease. But before that and after that, it's still heart disease. And there's different kinds of heart disease. So you have CAD, which we call coronary artery disease. We have congestive heart failure, cardiomyopathy, a lot of different kinds. But CAD, the coronary heart disease, is the most common one. Coronary basically means just the arteries and the vessels of the heart. This is where all the problems start. So in the US, you have someone having a heart attack every 40 seconds. So imagine how many people having heart attacks every day. 1 out of 5, so basically 20% of those heart attacks are silent. Silent means there is no symptoms. Sometimes you hear somebody who died in his sleep. They did an autopsy after that. They found the patient died of heart attack. The most common ones is uncontrolled diabetics, because when you're diabetic and you have problems in your nervous system, your nerves are not working properly, as well as your arteries. So it's common in diabetics that will not have any symptoms, they will not experience a chest pain, and they will have no symptoms of heart disease. So what happens in heart disease? Basically, your coronary arteries, coronary means cardiac, it's a Greek word. Basically, what coronary means, your heart arteries will be narrowed by fat deposits. So will be blocked by fat, as I'm going to show you in the next pictures. And then this blockage, if it depends how much is the blockage, it either causes chest pain or will lead direct to a heart attack. So here you see the picture on the left. So this is how normal cross-section should look like for a normal heart. It should be clean and clear. On the right, you see all this yellow is like fat. And what you call it plaque. That's like scientific word, plaque, which as you see in the cross section, it will cause narrowing. Imagine this is a hose and it's blocked. So you have less flow, less blood or less water going through. And then what happens next, let me try to find the other picture. So I'll get back to the slides I skipped. So you see the yellow part is a plaque, and then when you get a clot that blocks this, then you get the heart attack. So myocardial infarction is the scientific term of heart attacks. So infarction basically part of your heart or any part of the body. Myocardial means heart. Infarction means there's less blood flow to that section. When you have less blood flow, it can lead to ischemia, which basically this part dies and then you get the heart attack. This is just like, of course, this is not all the vessels in the heart. It just basically put the main larger vessels. You always hear like, oh, there's a block in the right coronary, like the RCA or like the left, the LCA or the circumference. Those are the bigger ones where they put stents. So you get the blockage, and then here, like again, you get the plaque, the clot blocks it, and then if the blockage in this area, whatever's supplied by this vessel is called damaged heart muscle. This is ischemia. Basically, there is no blood supply, and this part gets totally damaged. And this is when you get the heart attack. Basically, one of those bigger arteries get blocked, no supplies go into the muscle of the heart, and this is when you get the heart attack and you start experiencing symptoms. So again, this is just showing like, okay, the first one, the plaque builds up, basically the fat to simplify it. The second one, you have mostly blocked like 50%, and this is what we call angina. You start getting just chest pain on and off. So you get a patient complaining of chest pain, but it goes away. They give them sublingual nitro, and this is like early signs of someone's gonna get a heart attack. You get the heart attack when it's complete blockage, like the one on the bottom. So what's the typical symptoms of heart attack? So the most known one, and that everybody knows, is chest pain. Chest pain can last for like few seconds to a longer time. Usually like it's worse with exertion. It means if you walk and you experience chest pain, or if going up the stairs you experience chest pain, this is very alarming. Like you'd be sitting at rest, no issues. You start doing minimal activity, you have chest pain, can be right or left. That's very alarming. And it can be described as like pressure or tightness or squeezing. The patient will tell you, I feel like there's an elephant on my chest. There's a lot of different kinds of chest pain. Not every chest pain is a heart attack. For example, if you have a heavy meal, you lay in bed, you get chest pain. Most likely this is reflux. If your pain is worse when you move around or when you press on your chest wall, this is probably like your muscles. Like say you've been carrying a lot of heavy stuff, or people who go to the gym, like they're carrying weights. And then if I press on the chest and it's like, yeah, it's worse when I press with my hands, that's most likely not cardiac. But the cardiac pain is most likely like you feel like tightness, pressure, like an elephant sitting on your chest. It doesn't change its positioning. Like you sit, you lay in bed on the right side or the left side, it doesn't go away. And it can radiate to other areas, can shoot down your neck, your shoulders, your back, even your belly. The other symptoms, shortness of breath, nausea, vomiting, palpitations, you feel like your heart is beating fast, or fainting. In an older population, there is no typical symptom. That's why if you go to the ER, like say you're above 60 or 65, you go to the ER for abdominal pain. They're gonna do an EKG on you to make sure they're not missing anything. I remember when I was in residency, we had a patient who was actually younger, like in his 30s, going in and out the ER for belly pain. And they couldn't figure out what's going on. Went to GI, they did like all the cocktails. One day he came in, and unfortunately, this patient passed away. Of course, the family freaked out. They did an autopsy, and they found the patient died of heart attack. So chest pain is the most common and known symptoms, but doesn't mean everyone with heart attack presents with chest pain. It can be like, especially in older population, it can be like something like abdominal pain, back pain. So that's why sometimes we get people in the ER, like they're always like surprised. Okay, I think it comes chest pain. Why they're doing an EKG? It's a simple test. It takes a few minutes. They just don't want to miss anything. Then in women, sometimes it can present differently. Chest pain can or cannot present, and the reason they say this, because women experience much worse pain. Like a lot of them been through labor, so the labor pain is definitely much worse than the chest pain. So when they get chest pain, it's not a big deal. I mean, I've seen worse. This is not really pain. It's fine. So they can present with breathing problems, just feeling weak, feeling different. If you go to the ER, say, I feel different, I'm not myself, just have nausea, vomiting, they will do an EKG on you to make sure there is no heart attack and they're not missing anything. So what happens when you go to the ER? Number one, they're gonna do put you on oxygen. They'll connect you with this little like oxygen. They call it the nasal cannula. They'll put probably in 1 or 2 liters, even if your oxygen saturation is not low. They'll put an IV, and then they will do an EKG. That's the first thing that's gonna be done. Then they're gonna do blood work. What are we looking at the blood work? So we look for this enzyme called troponin. So when it's damage in the heart releases this enzyme called troponin, and it keeps going up. So what they do, they'll like get a first set of troponin, and then in a few hours, it can be 4 hours or 5 hours, they get another set, and then a third set. If the enzyme is going up, that means there's a very high risk, or most likely you're having a heart attack. So that's what they check when they just keep you in ER in observation. to check your blood work. Okay, I just had blood work. No, we're gonna get another set in 4 or 5 hours, and a third set. Then they do like a graph. If this graph is going up, then there's a high chance you're having a heart attack. They're gonna do sublingual nitro, so they're basically a little pill they're gonna put under your tongue. It's usually one dose is 0.4, or they can give you an IV nitro. So nitro opens the vessels. All those narrowed vessels, the nitroglycerin will open it up. And then they give you morphine for pain, so the IV morphine and aspirin, so to prevent the platelets from not clotting, to try to open up the clot. So we're talking about the EKG and the blood test. If they find, like, say, your troponins are going up, and okay, most likely it's a heart attack, then they're going to do an angiogram. So angiogram basically is what we call like the cardiac cast. They'll go in from your groin or from your wrist, and then they'll pass a tube. Let me see if I have. This is just an EKG picture. We don't have to go through this. So they'll go through, yeah. So this one I'm trying to get to. So let's say the first one is the blockage. So with an angiogram, they go in with this little catheter, like you see in the second picture, until they get to the clot. Once they get to the clot, they inflate the balloon. They'll put air, the balloon opens up, and then they put the stent. The stent looks exactly like, when you have a pen and you open it up, the stent that they put in, there's different kind of stents. Some are coated, some are not coated. This is how the stent looks like when they do like an angiogram or basically a cardiac cath. They inject dye. So, so you look at the picture on the left. So when they go in with the catheter, they inject dye. All this dark colors is injected dye, and then you see a little area in the circle that the dye didn't go through because it's blocked. After they open up with the stents, you'll get the picture on the right, which is open because they open the blockage with the stent, and now it's like wide open with a dye. This is what I talked about, stenting. So they go in from your groin or from your wrist, from your wrist down, not that high. And it doesn't make a difference. It's just like different passes. Every patient have like, they can have difficult veins on the groin or the arm. The interventional cardiologist will pick which side to go in from. That's the basics that is going to be done. And there was like different kind of EKGs. We don't have to go through this, but just for general knowledge, the most serious one is the ST elevation MI, which is number 3 here. When we see this in an EKG, this is where that's something they have to fly the patient, like to like a bigger hospital where they can have quicker interventions. We talked about the stents. This is another picture for blockage from an angiogram. On the left, there's 100% blockage. They put stents. Sometimes they have to put more than one stent. If there's blockage everywhere, like say they go in, there's too much blockage, they'll put a like stent in 1 or 2 locations, and then they probably have to do an open heart surgery. Not in the same setting, but they recommend an open heart surgery. Those stents basically is to patch the situation for now, and then they will have to see like a cardiothoracic surgeon. We'll talk about that open heart surgery. So this is when it gets more complicated, like we're talking about the ST elevation. So how do we reduce the heart disease risk? One, if you have any medical condition, it has to be under control. So people who have high blood pressure, they'll have to make sure it's under control, because high blood pressure, you can have no symptoms unless it gets super high, like 200 over 100. You have like a headache or nausea, sometimes vomiting. But if your blood pressure is like running in the 160s, 170s, you might have not any symptoms, and some people just ignore it. The doctor will prescribe blood pressure medicine and just, I'm fine, I don't have any symptoms. But if you ignore it, then it gets a bigger problem. You'll go into coronary heart disease, which we talked about. You can go into congestive heart failure because your heart is having a hard time pumping the blood because the pressure is so high. High cholesterol, because this is what caused all the plaques, the yellow part that we saw on earlier pictures. Diabetes have to be under control. You don't want to get a silent heart attack. Smoking, of course, you have to stop it if you're smoking, and you try to avoid secondary smoking too. Yes, try to exercise a few times a week, and whatever you can do. Doesn't mean everyone has to run 30 minutes or walk. Whatever you can do, even if you're in a wheelchair, there's some minimal activities, but don't just sit like watching TV 24/7. Those are the people who get heart attacks. Overweight people, they need to lose weight. And then your diet. Basically, you try to make this simple, to try to avoid processed food. All the processed food like has a lot of preservative, a lot of chemicals. This is what can cause heart attack. Alcohol, there were studies before that used to say, oh, if you drink 1 glass of red wine every night will help with your heart. And last year it was proven to be wrong. So if you can avoid alcohol completely, that would be great. If you cannot, don't go more than 1 glass a day. Depression and stress can cause a heart attack. So if you're living a very stressful life, you try to eliminate. I know it's not easy, but depression and stress can cause heart attacks. Think that's the main slides. If anyone has questions about this or anything else, I'll be happy to answer.
Thank you, Dr. Behiri. Well, we will take questions now from our attendees. Attendees, do we have any questions? And you're welcome to put them in the chat or the Q&A box, either one. Dr. Behiri, the first question we have was, you mentioned that age is not relative to the heart attack, that you could be a young person that actually has a heart attack. The question is, would you explain some more about why at a young age you could potentially have a heart attack?
Because younger ages can be genetic. So when you go to any doctor or ER or whatever, especially if you're younger, they're gonna ask you, what's your family history? If I'm like 35 and I'm walking to ER, tell my dad died at age of 40 or 50 of heart attack, that's genetic. Every disease has a genetic component. So it's very alarming if you have people like die young in your family. So that's why, of course, it's most common in older population, but I was trying to say you cannot just ignore it in younger population too, especially if you have high risk factors too. Let's say you have somebody who's 35, morbidly obese, hypertension, diabetes, of course they can get a heart attack. So it's the lifestyle and genetic plays a very important factor.
Thank you, Dr. Bahiri. So the second question I have from the audience tonight is, you talked about a heart healthy diet and you had some pictures in there. Would you share some main foods that could be maybe healthy snacks or healthy foods you might recommend to a patient if they had CAD?
So again, everything think of it like natural, like fruits, vegetables. Fish, of course, is very healthy because full of omega-3, especially salmon, full of omega-3. I wouldn't eat a lot of beef. Chicken is fine. It's a lot of protein, especially chicken breast, and less fat. But definitely stay away like from hot dogs, popcorn, anything that's not made like by God directly. I wouldn't like. Even eggs are fine. Eggs don't have that much cholesterol. Like those a study, it was a very old one, like in the 60s. Somebody ate like 36 eggs a day, every day, I don't know for how long. He was totally fine. His cholesterol was fine. So eggs, that's why I see an egg in the picture. Nuts and yogurt, Greek yogurt especially, that's fine. But I wouldn't go with canned food, hot dogs, burgers, pizzas. That's all like definitely not healthy.
Thank you, Dr. Bahiri, and thank you, attendees, for those questions. And I have another question in the chat box here. And the next question, Dr. Bahiri, is how does AFib affect the heart?
So AFib is basically a regular heartbeat. So the heartbeats come out from the SA node. So it's a node in the heart. It's called an SA node. So if your heart, let's say to make it simple, you have supposed to have a beat every second. We'll have like one every second, then the second one in 2 seconds, and it's all over the place. And then if it's not controlled, so you have two components. In AFib, one, the heart rate is very high and irregular. So the most important to control is the tachycardia, the very high heart rate. Let's say I get a patient with AFib, his heart rate running 120 and it's irregular. So we have two problems. Very hard heart rate, and this needs to come down first. So most likely those patients are like on something like metoprolol or cardizem to bring the heart rate down. And then to keep it regular or not, this can be they might have to do like to break the SA node, or they put them on certain meds like amiodarone, and most likely they're going to be on blood thinners, because when you have a lot of gap between the heartbeats, the longer the gap is, this is when you can form a clot, even as like a portion of a second. For us, it doesn't look very long, but that's what affects the heart. That's why like most people with AFib, you're gonna see them on cardizem or metoprolol, one of the newer drugs or amiodarone, but you're also gonna see them like on Eliquis or Xarelto or Coumadin. I don't know this. Hope this answers the question.
Thank you, Dr. Bahiri. I think that did a good overview. I do have another question for you as well. The next question would be to the factor of, on here you talked about depression. So this is a great slide to be on still, Dr. Bahiri. The question is, for some signs and symptoms of depression, what would that look like?
Signs of depression.
Yes.
So usually the most like they wake up very sad in the morning. Usually like the earlier in the day is worse than the end of the day. You wake up like very sad, very grumpy. Some people eat more, like they'll just eat everything in front of them. Some people will eat less. Oh, I have no appetite, I'm depressed, I'm not in a good mood. They try to avoid people, that don't want to talk to people. Sometimes they don't want to discuss the problem, they lose weight or gain weight. That's when you start, or like you're thinking about one problem nonstop. This is the most common signs.
Thank you, Dr. Bahiri. Are there any more questions from the attendees? One more question, Dr. Bahiri. Is there a recommendation of how much cardio exercise should be incorporated into a weekly routine? And the second part of that question is there a particular exercise that is best to keep the heart healthy?
There's nothing particular, but I would say you exercise at least 3 times a week. So, and especially the older population, everyone is different. Some people can run, some people can just walk. Some people in a wheelchair, they'll just can move like their upper extremities. But whatever you can do, like 3 times a week, half an hour, it would be great. But you don't have to run. I know people think like running is gonna protect my heart. There's a lot of side effects too, especially on your knees and stuff. Very sorry I couldn't open my camera. I'm not sure what's going on, but like I've been trying since I started the presentation, but it's not like I'm hiding from you guys.
Thank you, Dr. Bahir. We know that you're here and present, and thank you for answering that question too as well. So, audience and attendees, is there any other questions you would like to ask Dr. Bahiri at this time? Dr. Behiri, on behalf of Retirement Unlimited Incorporated, we have had a great evening this evening and have some tips to share and know how to better care of our residents. So we want to say thank you, thank you, thank you.
No,
And
thank you for having me, and you guys have a great night. And again, it was my pleasure.
thank you for that. And audience, as we are winding down, we just want to remind too, we're going to continue with the same sign and thoughts of managing our health. This series will be brought to you too on other mediums and social media streams. But our next presenter, Wednesday, March 19th from 5 to 6. And you can click on the link or share the QR code, and the link is in the chat. We will resend that. But managing health through culinary experience. Our featuring guest speaker will be our very own Chef Joshua Manning, our Regional Director of Culinary Operations for RUI.